Welcome to a new episode of our weekly series on COVID-19, Science in Context. The UK has now reached more than 4.3 million confirmed cases, and more than 32 million adults have received their first dose of a vaccine. Earlier this week, England moved into stage 2 of the government's roadmap to ease restrictions. I'm Stephen, and joining me today is Professor Stephen Riley.
Stephen, with the UK vaccine rollout currently on track and some restrictions easing this week, what is the outlook for the UK?
The most recent data in the UK are very positive because of the effective lockdown and the really successful rollout of the vaccine to those most at risk. We've seen deaths, hospitalizations, cases all plummet, and also infections as we measure them in the REACT study or ONS study. So the recent data is very good. I think that a lot of the effect or the impact has been from the lockdown. So as we relax that, we would certainly expect infections to start possibly to go up, or certainly to continue to plateau. And then we have to watch very carefully for how that knock-on effect goes to hospitalizations and deaths.
In parts of London, there has been a cluster of cases of the variant first detected in South Africa. What impact could this have?
It's certainly, as they're called, variant of concern. This is a concern, but we have to look back a little bit at kind of the data on variants from the first part of the year, and we have seen clusters of this same strain before, and that hasn't led to a rapid takeoff. So even though it's a different situation now with lockdown being eased, I think that's a little bit reassuring. The other data we should look to is from Israel, where they've also observed some of this variant in a very heavily vaccinated population, and it's not yet risen to dominance or grown. So although we have to watch it and be concerned, it's not immediately apparent that it will be a large problem.
Thank you for your time.
You're welcome.